Hey ma'am, I'm Rihanna. I'm going to be your nurse today. Can you please tell me your name and date of birth?
Yes, Taylor Swift, 3382.
Awesome. So I talked to your physician, Cindy Light, and I just wanted to ask you a couple questions. What kind of happened when you came in today?
I was picking up my son from school, and I was in the pickup line. Everything was fine. All of a sudden, my heart started beating really fast. Couldn't catch my breath. Kind of started to get a little anxious. And with my history, I had a heart attack a couple years ago, and hypertension really runs in my family. So I got a little squirt in the car, and I got him home, and my husband just thought it would be best just to come in. So I'm still feeling my heart's beating really fast. You're the first one to come in here, so.
Okay, well, let's do a couple vital signs real quick, and we're just going to get those baseline in for Dr. Light. You have been diagnosed with atrial fibrillation. But the good news is there's things that we can do to prolong your life and let you spend more time with your kids. Would you like to talk about some of those things?
That would be great.
Okay, so what do you do for exercise right now?
Not a lot. I chase my kids around, but that's really it. I'm so busy.
Okay, so maybe we could walk for like 20 minutes or so. Do you have a treadmill at home?
I think my husband has one in the basement.
That would be awesome. You could even bring it to the family room, and while your kids are watching TV, you're playing with each other, you could walk while they do that.
Yeah.
And we could also start working towards a better diet maybe. Can you tell me more about your diet?
Yeah, that's the same thing. It's so hard with kids, and they're so young, and they just want all this food that isn't good for them, and it's just easier for me to eat that.
Okay, so I can set you up with a consultation with a dietitian. And so now I'm going to talk to you about what your doctor has prescribed for your diagnosis. Are you ready to learn about that?
I think so.
Okay. Dr. Light has prescribed Cardizem, which is a calcium channel blocker that's going to work to slow down your heart. So I'm going to give you this pamphlet with some information in it. And as I talk to you about it, you can kind of follow along with me.
Okay.
So you're going to be taking 60 milligrams, and we're going to be taking it twice a day. So some of the side effects that this can cause is orthostatic hypotension, So that can mean when you're getting up really fast, it might cause you to feel dizzy or faint. So we're going to want you to get up very slowly and change your positions very slowly. It can also cause the lightheadedness when you're standing up for long periods of time. So just take a rest every once in a while. Then there are a couple things we will want you to call the doctor if you start experiencing. So first I want you to touch right here, right on your wrist. And what we're going to do is we're going to learn how to take your apical pulse. Do you feel your pulse? Awesome. So what you're going to want to do is take that for a full minute, and you can time that on your watch on your other hand. And you're going to want to make sure that your heart rate stays from 60 to 100, around in there.
Okay.
When I took your vital signs earlier, it was about 99, which is kind of high, but the prescription we have for you is going to help slow it down. But if it is over 100, we're going to want you to call the physician. That's just a side effect we just don't want to see because we want to slow your heart down. Do you understand that? Okay.
So today when my heart was feeling like it wasn't beating fast, just irregular like it was, and I couldn't, calm down, I felt anxious. I just need to watch out for that and call the doctor if I feel that way again.
Yes, that's a great question. Definitely if you feel like this again, I'm going to want you to call Dr. Light and see what she has to say. You might have to come in, but she's going to be the one I'd like you to call.
Okay.
Also, if you start to notice a rash while you're taking this, please call the doctor. That's just another sign that the medication may not be right for you, and we need to find
I think I read that in here that it said if a rash appears anywhere on the body to call.
That's wonderful. I'm glad you're reading your pamphlet. And if I have any more information, would you like me to print it out for you to take home?
That would be great.
So I just wanted to talk to you about your comorbidities, which that just means your history, like your hypertension, and your MI that you had a couple years ago. Because of that, you have a higher risk of having another MI or a heart attack. So this is the reason we're taking these pills, and we're going to hopefully decrease that chance just a little bit. So before I give you your first dose, can you tell me a couple highlights of our education that we talked about?
I remember you teaching me how to do my pulse, and then that if it's less than 50, I don't do it, and I feel for a whole minute.
Very good.
And then watch for a rash, just in case, and I might feel nauseated a little bit, so maybe take it with food.
Great.
And then you said a big word, but it was that I need to be careful when I get up or standing for long periods of time. I might get lightheaded.
Very good. That's called orthostatic hypotension, but that's exactly right. Was there any food you shouldn't take this with or drink?
Grapefruit juice.
Very good. And should you crush the pill?
No.
Very good. All right, so here's your first dose.
Thank you.
You're welcome. And Dr. Light has scheduled a follow-up with you tomorrow. So you'll come in about 8 o'clock in the clinic, and she's just going to make sure everything's going well and check to see how you're doing with the medication.
Okay.
Does that sound like a plan?
So I just go home and just start medication?
Yep. We're going to discharge you today, so I'm going to print out everything about the education.